One, two. Okay. Tony, have we started now?
Yes.
Okay. Good morning, good afternoon, everybody. My name is Nasser Masoud. I'm the chair of the Social Sector PPPs chapter at WAP. And it gives me really a lot of pleasure to be hosting this panel. It's an unusual panel for our chapter to kind of discuss at a much higher level public policies and how they impact the way in which governments and line ministries start to structure their PPP pipeline and what kind of projects they will admit into the pipeline and which ones they won't, whether it's size, whether it's nature, services, not services, and so on, and also how they structure them and deliver them and get value from them. And we've really got a great lineup of speakers today. And the panel is going to be moderated by my colleague and my friend, Gazmir Vahder. Gazi was formerly the head of the PPP unit in Albania, and he's now active in several areas, but primarily in the social sector. Gazi, I'll pass over to you. Gazi, of course, is a member of the leadership team for the Social Sector PPPs chapter as well. So without further ado, I'll pass on to Gazi to introduce the panel and the panelists. Go ahead, Gazi.
Thank you very much, Nasser, for the introduction. Thank you everyone that are registered today for the webinar. I'm starting to present the panelists. I'll start with Felicitas Colombo, which is the Director of Public and Government Affairs in American Health Foundation and Managing Director and Vaccine Beat. Felicitas has spent more than 20 years with strategies and regional and global impact, fostering multi-stakeholders collaboration to shape the public policies. She leads projects on regulatory and policy analysis and strategy communications all over the world. So she has a lot of experience. For more details on her background, I will let Felicitas introduce herself, and I will let all the panelists introduce themselves when they start speaking. So the next panelist is Luigi De Pieris. He's a founder and director and Ancient Development and Development Foundation in Namibia. He has a very huge experience as a consultant in PPPs. I've been working with Luigi a long time ago when he was working in the Central European Investment Bank. He with WBIF we have worked together many times. So Luigi has a huge experience, but he is going to introduce himself a little bit later. Then I continue with the other panelist, which is Mario Turkovic. Mario is an experienced PPP expert, which he has now is a CEO of Energovizia company in Croatia. But he has been working so long with the PPPs, with the OECD and Sigma and IFC and many other actors. Mario has a huge experience in preparing legislations and with EU accession procedures and so on. So thank you, Mario. We'll come back to you again later. And then a very special, the last but very special one is the Priscilla Romano Pinheiro. Is a PPP specialist from the American continent, from the South America, from Brazil. She's a board member of Fundação Dom Cobral, if I pronounce it very well. She is a certified CP3P expert. And very professional in PPPs, and she has a very huge experience in concessions and PPPs with more than 20 years. So thank you very much for all of you being here today. and I would like to make an introduction of the webinar before I start with the first panelist and so on. So I mean the public partnerships have become increasingly important for governments to deliver infrastructure and public services by leveraging private sector resources, expertise, and innovation. So the success of PPPs, however, depends heavily on the policy environment uh, within which they are designed and implemented. So uh, it sounds like policies set rules of engagement, define responsibilities, establish risk-sharing mechanisms, and align projects with broader national development strategies. They also ensure that transparency, ensure transparency accordingly and value for money, which are essential for maintaining the public trust. In the absence of, let's say, coherent policies, PPP risk facing delays, financial imbalances, and government challenges. So in this way, PPP-related policies act as both as an enabler and a safeguard, encouraging private sector participation while ensuring the project remain aligned with long-term public objectives such as sustainability, inclusive, and resilience. So this was just an intro, but our guest will talk more about this in today's webinar. So without losing more time, I will start with Luigi. Please, Luigi, first make an introduction of yourself, and then let's start with our discussion. Please unmute, Luigi. Luigi, you are
Luigi,
muted.
you're
Luigi,
muted.
you're muted.
Luigi, you're muted.
I should start again, and now you.
Yes, please.
Yeah.
Thank you very much, Ghazi, for your introduction. I have to start with an apology because what happens is that because of the fact that the schedule was moved many times, now I am during a mission in Ethiopia, and so I only have 20 minutes, 25 minutes, and then I will have to disconnect. So I apologize for my lack of good manners, but this is not intended. It's a pleasure to reconnect with the Ghazi, with whom I worked, very well in the past in Western Balkans. The pleasure to reconnect with Nasser, and also pleasure to meet all the other colleagues and with the audience. I will tell very little about myself. I've been around for over 30 years in PPPs because I started in Paris when I was part of the project finance team of Banque Paribas, and I was especially in charge of emerging markets. So at the time, I even have the pleasure of going to Salvador de Bahia because there was an underground project at the time. So we're talking about 2000. But then I've been head of the PP unit in Italy. And then I've covered many other positions. Notably, I've been with EPEC at the AB for a few years. And now I've retired from the AB and I continue to work as an independent consultant. And Ascent is an NGO which I founded, which has little to do with PPPs, but it is a corporate vehicle that basically I sometimes like to promote because we are in the business of helping other people. Now, regarding the theme of today, PPPs in the social sector. So we have to use some terminology and to understand what is social sector. So I think here there is no right or wrong. I think everyone may have a definition. To me, what is the social sector is I'm a pragmatist. So it's very much I look at what are the relationships among the stakeholders. And really what we call social is the services that help human being. So things like, the healthcare, things like schools, these are probably the quintessential, social PPPs. In the UK, some 20 years ago, they were using another terminology. They were talking about government accommodation. So PPPs that were very much meant to provide the government with facilities, but where the services were offered to the government, and the government would be the client. So it was a combination of construction on new built office infrastructure and the provision of services. So this was they were very simple transactions, but there were quite many done, at the beginning of the millennium. Notably, there was, I remember having been in the embassy of the UK in Berlin, and that was a PPP. So it was a case where it was a sort of it was a UK transaction, but in a different country. You know that embassies have extraterritoriality. But in order to be a bit perhaps more precise, I think we should go to a definition to an important feature of the social structure in social PPPs, which is very much different. The very difference is that PPPs are of two types: user pay and government pay. User pay means that the service is provided directly to the end users, which pay for the use of the service. Typically, an underground system, you have to buy the ticket, which may or may not be enough to ensure the repayment of the loans and the remuneration of the shareholders. But there is a flow of revenues that comes directly from the end users. Whereas in social PPPs, they are always of the kind of government pay. So the government would pay the bill in the end. Now, in which form the bill is paid is different, because you may have a situation whereby there is just one payment which is predefined, so it's not variable according to the level of use of the facilities. But this one I would not even qualify as a PPP. This one would be a sort of operating leasing or something like that. I think it's more common situation where the grantor wants to retain control over the quality of services and would maintain the right to apply penalties and also incentives to encourage good performance. So, for instance, in the case of schools, there are some KPIs, key performance indicators, which are, the number of rooms that are open, how many hours they are open, if they have some activity after school, after the school hours. So there are, every subsector has rules. And the other thing I would like also to make an historical remark. When I started working in Italy on PPPs, actually there was no concept of PPP different from the one of a concession. So in fact, we could not do PPPs because the law wanted that all the concession contracts, because PPP were concession contracts from a legal standpoint, so they had to be based on user revenues. So we had to go through a reform to allow for, social PPPs, transaction where, the government is the payer of the remuneration for the concessionaire. So, which brings me to the other point. So the point of the definition of value for money.
Oh.
Because, now I think with the PPPs, they've been very fashionable some 20 years ago. And then, there has been very different situations. Sometimes they are very popular, but they also were questioned. And especially in the UK, there were a lot of voices that were against PPPs, because they realized that, especially in the occasion of some transactions, that the concessionaire were having a very easy life. And there were cases where the concessionaire was sold by the original shareholder with a very important profit. So all that actually did not go well with the public opinion. So all this had to be rethought from the beginning. So now I think that now what the good practice is that when a government, a city council wants to go about a social project, they should go about the preparation with an open mind. So they should not decide beforehand whether it's going to be a PPP or it's going to be a traditional. Because, it's very important to analyze both options. So now one established good practice is for government to have what is called single project pipeline. So no difference between PPPs and the public procured projects. This is in the interest of maintaining a coherence in the planning of new infrastructure investment. Because also in PPPs, there is this very popular attraction of unsolicited proposals. So sometimes, promoters would come in front of an administration and would tell people, we can provide for you this beautiful school complex. And then, it becomes a direct negotiation, which is very unlikely to deliver value for money, because value for money is delivered through competition. So when an administration only speaks with one potential supplier of services, then it's very difficult for the administration to realize value for money, because there is no effect of the competitive pressure. So to come back to my old point, it's very important that all these initiatives are carefully programmed and prepared by the government or the public administration that is promoting the activity. In terms of how you can assess value for money, I remember hospital projects. If you think of an hospital, even when it is procured as a traditional, the health authority would always have a number of contracts with subcontractors. So they're very much used to the complexity of managing, contracts they have to have, cleaning, heating, they have to service the building, they need, to pay for the laundry, they have to manage, the dangerous waste. So every health authority is already used to this complexity. So the question is, what is the value added of a PPP? Because even if the hospital is built on a traditional, it would not, the public partner would not do everything. They would only do certain things. Then they would rely on the private sector to provide a number of services. Now, the main difference between a publicly procured hospital, a PPP, is that there is this linkage between the construction of the facilities and the provision of service, which is very much in place from day one, which means that the hospital is built already with a concept of facilitating the delivery of services. So all this kind of, interface issues that you can have when the construction of the hospital and is designed, regardless of what the different providers of services have to do, is, if not removed, is really mitigated. There are little things like the way you build facilities so that they can be cleaned more efficiently. I've been working many years ago on a hospital in northern Italy, in Trento, in the province of Trento. And to that, I know that there are people from the province of Trento in the audience now. So it would be nice to give them the opportunity to say what they think about that. But we had prepared the project very carefully, and it was procured through the usual to the avenue of public procurement. And then the project could not go ahead because there was some, after the project award was challenged. So the procedure was basically declared void after having done everything. But so the project is still stuck. But then the decision, was difficult. Why I'm mentioning this? Because, the health authority was already very sophisticated, in allocating the services. So for us, it was very difficult to demonstrate that, a private concessionaire was in a position to do better. And this is something that is often neglected, because the enthusiasm of doing a PPP, there is this idea that PPPs deliver better, but this should be very much substantiated by careful analysis, which we did in that case, although the end result was a bit disappointing. Because in spite of all the work done, still, and I'm talking about something launched 15 years ago, and which is still, stuck. So there's still, legal battles on this.
Yeah. So what other hurdles come in your mind, Luigi? Because this is one of them, of course, but somehow we should show the audience what are the other hurdles coming up when we try to implement the social PPPs. Can you talk a little bit on?
Well, the other challenges are a part of value for money. The other challenges are, to find the fiscal space. And, in not all jurisdictions, they have a system where they can do multi-annual public budgeting. So it's very difficult for administration to have, a crystal clear appropriation of resources to the service of the cost of the project. And this element is what really kills, I have to use a very hard word, PPPs in developing countries, because investors would not believe in the ability of a government to basically to maintain the appropriations of fiscal space over the years. And this is why, when we speak about PPPs in countries, especially in Africa, I work very much in Africa. Now I'm in Addis Ababa, Ethiopia. And the problem that we have is not that we do not have good business ideas, good proposals, but the point is that the fiscal space is very limited. So the risk is sometimes people are, carried away. So they'd like to go ahead with the project, and then you can have a situation of first come, first serve. So you have a sort of maiden project which is launched, but then after the fact you realize that this project is absorbing all the fiscal space. You see what I mean? Yeah. So these are the challenges, So I would say the two main challenges are, the certainty about the appropriation of the fiscal space, and the other one is to deliver demonstrable value for money. There have been many reports in the UK, and then Nasser, you know better than me as you are British, of the NAO. And my own reading of those reports is that they are inconclusive, in the sense that they are not able to demonstrate conclusively that value for money has been delivered, but at the same time, they cannot demonstrate that value for money has not been delivered. So it depends how you want, to see these things. But for the practitioner, the challenge is always, to work in a way that is transparent, and also that you can defend in front of the public opinion your choice. One problem that we had in Italy is that after the PPPs, the health authorities were realizing that they were spending more than before, but they were completely forgetting that they were also paying for the construction of the infrastructure. Because as you know, in project financing, what you pay to the concessionaire can be, broken down to two components. One is the service component, and the other one is what is called the capacity charge. So those guys, the health authorities, were looking. They say, "Oh, come on!" But before the PPPs, we were paying much less because we're only looking at the cost of the services. They didn't realize that they were also paying for the capacity, for the new capacity. So this is an example of the misconceptions that can arise in these projects. So I really have to warn everyone here that whereas it's easier, to do a user pay PPP, government pay, really need to be very, very strong in terms of quality of preparation. Otherwise, the chances that your work is going to be challenged are extremely high. There are also other sectors where you have country-specific legal hurdles. At a certain point, I wanted to introduce PPPs in prisons in Italy. You know that we have a problem in Italy because we have too many inmates and too few prisons. So we thought perhaps a program of PPP prison would be very useful. So I went to speak with the Minister of Justice, and they explained me that because of legislation, prisons can only be built by the Ministry of Public Works. Period. There was no way around it. And this is also one reason why in Italy still we have prisons that were built, two centuries ago, and you have big problems in terms of ensuring, a sort of a decent treatment to inmates in this country. I will stop here because unfortunately I have little time, and I would like to take a question. I apologize with the other panelists because I've claimed the precedence, but it is for a reason.
Luigi, thank you very much. Thank you very much. We were listening you carefully because you have always good examples and good tips to share with us. So we would let you go, and I will thank you very much for being here and sharing with you. We will look forward to see you in other panels.
Absolutely. And I will reconnect because I know that the beauty of these webinars is that you can see them even after the fact. So I promise to all the fellow panelists that tonight I will connect and we'll see your performance.
Okay? You can watch the recording. But if I may, Gaz, which you mentioned about the National Audit Office and value for money and so on, and there's a lot of truth in what you said. I was involved in what turned out to be the first PPP project in the UK. And then the first major one that was done by the Ministry of Defense. And of course, we have their National Audit Office all over us, trying to work out what we're doing and so on. Now, one of the things that I experienced is that assessing value for money is both science and art. Because depending on how you want to actually present the result, if you want positive result, you just need to work on presenting it so that it can be positive. And and there was a lot like that done. And I think when Ipsos-Stat came in, that's when reality hit, because Ipsos-Stat kind of turned the table around on what can be government debt and what can't be government debt. And if you remember, suddenly Italy ended up with a lot of public debt as a result of just the redefinition of what constitutes that, and therefore, was that value for money if the government ended up paying more, thinking it was having a project off balance sheet, but then in retrospect ended up having it on its balance sheet, so it didn't gain either way. But I think the one thing that is real in these projects is that they did get delivered on time. They did finish on budget. People started using them. And on another point you mentioned, which is on, maybe it's better to structure it as user pay. We're working on some projects in Uzbekistan right now. And although I'm not involved in the sector, but I sit on the Saudi Uzbek Business Council where they're doing some water projects. And of course, the cost coming up is 10 times the tariff that users are used to paying, which means there's a huge government subsidy, there's a lot of cost that doesn't get represented and so on. And now, how do you evaluate value for money? Because value for money is actually 10 times what the users are paying. But the government will not charge them that. But the government cannot openly subsidize a private partner with something like this. And this, of course, is all going to come to fruition very soon because there's a big need for clean water and done much more efficiently with more energy efficient methods in Uzbekistan. And these are just like very, very few examples of what's existing worldwide. So yeah, the public policy in relation to how you evaluate projects is absolutely. But thank you very much for your intervention, Luigi.
Thank you, Nasser, for your remarks.
Bye-bye
to everyone, and I hope to see all of you soon, perhaps at the next meeting. Okay, bye-bye.
Thank you, Luigi.
Bye-bye, thanks.
Thank you, Luigi. for you. If there are any questions that we should address to Luigi, because he is left now, so you can write on chat, and then we can respond to with Luigi later. Maybe we can share it, or so we continue with the other guest, the other panelist, which is Felicitas. Felicitas, thank you for coming. I would like you to make an introduction a little bit more than me for yourself, and then we can start our discussion.
Thank you, Gasmir and Nasser and all the panelists and the audience who's here. As you mentioned, my background is in regulatory analysis, policy design, and mainly in the healthcare area. Both I am interested in consolidating good PPPs for the good of public health, and as well as transparency. My interests are and passions are transparency, ethics, risk assessment, and anti-corruption as well. So in that regard, I think that those are also relevant topics to discuss here, because the public policies play a foundational role in determining the success of PPPs. They set they're the ecosystem in which we operate, and I think the conversation is very relevant, and thank you for bringing it up, because they set the legal, institutional, and financial frameworks for successful PPPs to operate. Well-designed policies enable confidence, attract investment, and ensure that projects are implemented efficiently and sustainably long-term. I mean, that's one of the challenges that we have in healthcare: long-term sustainability and financial support. So when public policies are predictable, and stable, they attract investment, which is the backbone for everything that we do in healthcare in terms of successful partnerships. When they are fragmented, too bureaucratic, and politically volatile, which is also many times the case in rotating governments, they become a challenge. And one of the big examples that we've probably all been witness of is the pandemic, COVID-19. And here I'm going to introduce some of the transparency issues and some of the ethical issues that are related to successful PPPs and the challenges that we had to overcome during the pandemic, where there were cases at an extreme level where public officials were forced to resign due to increasing reports of fraud, mismanagement of public funds, and money laundering, which are part of poor frameworks, regulatory frameworks. FATFA, I have some data here from back then that's very interesting. FATFA, which is the Financial Action Task Force, released an update published on the US Department of Treasury website in October of 2020 on risk information and recent back then, case studies demonstrating how criminals have been taking advantage of the COVID-19 pandemic with an increase of counterfeiting, cybercrime, and fraud related to stimulus measures. So all the public funding. This is quote unquote, this is verbatim. So we saw that under the premise of an imminent crisis, norms and regulations became flexible. Procurement protocols were overridden, whistleblowers were silenced, audit institutions were bypassed, and governance and accountability was weakened. And I'm putting this example, this is a big example, because we can all relate. I mean, then I'm going to reference some of the smaller projects that I'm working with that perhaps are more tangible in terms of the dimension that we operate in, our regional or local ecosystem. But, at the bigger stance, this is what happens also. The Lancet, I'm going to quote another published article in 2019. The Lancet published an article that stated that out of the estimated more than 7 trillion the world spends in health services, between 10 and 25 is lost to corruption. Yet again, we see frameworks that are weakened and allow for these things to happen. This is stretching the boundaries of sometimes perfectly functional regulatory frameworks. So even when the frameworks are very well put together and we have solid wording and policy frameworks, still this can happen. And these transgressions also generate inconsistencies and offset public trust. The uprising of social empowerment groups demanding that governments and companies both follow ethical norms and act responsibly towards society, or face boycotts, public opinion demise, etc. I mean, the repercussions are plenty. But this is at a higher level yet again. The people demanding that these frameworks are in place in order for PPPs to be successful, and especially in healthcare, the consequences are very visible and sometimes even fatal. So a simple conclusion to this first introduction is that hazy policies allow for accommodating loopholes in the regulatory environment, and this prevents successful PPPs.
Yeah, very good you bring out this outcome. So it is good to hear that sometimes they may help policies, I mean, and sometimes they may become more dangerous than we think, let's say like that. But I would like to hear from you. I mean, what are the key elements of an effective framework, for example? What can you share with us? What are your thoughts about that? What's your perspective on this?
Yeah, thank you, Gasmir, because I went to the fatal aspect of the frameworks, but yes, there are pillars that defend the success of the regulatory environments and the PPPs in um, in a pragmatic way. So the first one, I would say, it's legal and regulatory clarity, well-defined frameworks, clear frameworks that ensure roles and responsibilities, financial viability, long-term sustainability, etc. Then institutional capacity and coordination, establishing an agency or a technical support group or experts that are consistently preparing and monitoring projects. Transparent risk allocation. So a good framework also would outline how risks are distributed among stakeholders. And risks and responsibilities, right? A long-term pipeline and project preparation and support, feasibility studies, demand assessment, financial modelings, risk assessments as well.
Yeah.
And then mechanisms for dispute resolution just in case. So this attracts also financial support if there's reliable if there's an unreliable judicial system, then companies are not much enticed to get into PPPs because there's no resolution or arbitration tribunals. So in terms of risk assessment, I think that's another point that it's important. And yeah, I think those 5 would be the first pillars I think that should be contributing to successful PPPs.
Yeah. And also, let me bring into attention the procurement regulations, because these are the most important things in our field. So we sometimes we see that they have, I mean, they bring transparency, but of course they have to be implemented carefully, because they are the main tools that we are working. When we are working, we use them to achieve, I mean, better projects and a clear process. So, can you share something? I mean, do you have any perspective on this procurement regulations according to your experience? How do they affect? Do they bring the effect that we are waiting, or not?
Yeah, it's true. That's another very important point. Procurement and transparency frameworks. I would add transparency as well. So on that aspect, I think it's a double-edged sword in PPPs. They promote, on the one hand, they can promote accountability, reduce corruption, and build trust. On the other hand, if they're too rigid or outdated, they can stifle innovation and delay project execution. They help bring transparent bidding and evaluation frameworks, rules that ensure projects are awarded on merit instead of reducing and I mean and enhancing public confidence. So the disclosure requirements are important as well, publishing the contracts and performance data and help monitor the project itself through compliance mechanisms that deter misconduct also helps. For example, in Brazil, enhanced procurement laws have improved the private sector involvement and participation in PPPs in PPP projects. Because they offer transparent tender processes and dispute resolution channels, like we were talking before. So those are the good aspects of the regulation. And then some countries that have more generic procurement laws perhaps deter the involvement of the private sector, because they're hazy laws, their regulations, it's difficult to assess how their involvement would be, like we said, also value, cost benefit value assessments, and rigid frameworks that insist on lowest cost bidding often fail to consider quality, long-term value, and innovation. That's another challenge. I will also go back to the example of COVID-19 and the pandemic. Some of the procurement was based on cost and not quality, and we had many cases in different countries where they had to throw away syringes, many things, because they were useless based on costs. So yeah, I would say that those are the main points regarding good procurement regulations and transparency laws.
Yes, you're right, Felicitas. So You brought a lot of examples, but if you have any, specific example that you want to share with us, I mean, in healthcare maybe or in other fields, please feel free to share with the audience. Or so, what you have, I mean, something that you want to bring up.
Yeah, I mean, to conclude, I have so many lessons learned that I would want to share and mix with some examples to bring clarity to what I'm saying, because sometimes, you know, this is a very particular area, healthcare, that's not infrastructure, that's not the common PPP environment. But I think my lessons learned are strong regulatory frameworks are essential. Without clear standards, PPPs risks sometimes becoming profit driven instead of at the expense of patient welfare. And that's a big risk, especially in public health. Public capacity and commitment. I mean, the government must be an active partner. We have a case in Latin America. I'm working for years. I've been working to get public. The private and public sectors to have a regional registry for rare diseases, which is sometimes on paper in law, but it's not implemented. So we have the project, we have some funding, committed funding, but it's very difficult for me to decide to implement it, because sometimes there are many issues with this, which is one of them is long term. If you don't have data that goes long term, then implementing a system, it's useless, because the short term data expires within a year or two. I mean, so you need to constantly, so you need funding for that. So long-term commitment from both governments and the private sector is very difficult. I don't know if infrastructure might not be the same, um, have the same hurdle, but in healthcare, you need very long-term commitments for the sustainability of these projects. And I don't see that in this case, in this example. So yeah, commitments. Financial sustainability, as we were saying, must be considered upfront, because sometimes the private sector commits funding for 2-3 years, and then what? So these platforms need long-term commitment. Also on the part of the governments, I mean, you have rotating politicians, you have rotating um, leadership.
Yeah.
So what one sign, the following unsigns. So that's always a challenge. Ministries of health and other organizations within government, the people come and go, the ideologies and the things they want to support, their agenda changes dramatically sometimes. Then community engagement and trust building, that's also very important. Public trust, especially in big projects that involve public health initiatives. Compliance, we talked about. Transparency. Well, here I want to, within transparency, I must say that within my experience of, both regulatory and policy background and strategic communications, I'm not a big fan of full transparency, but adequate disclosure managed by an impartial entity that generate confidence among stakeholders. So full transparency sometimes can create problems. I have witnessed that for the sake of full transparency, there's been mismanaged or misinterpreted information disclosed. and used out of context that generate, as I said, many problems. So that's why I think well-managed information disclosed by an impartial entity, an impartial communicating entity or organization is it's better in the long run. I am into risk management above all, above transparency even. So that's a big word when we talk about transparency, and I just want to share with you my experience on that. Risk and responsibility allocation amongst all stakeholders is another lesson learned in order for successful PPPs to come to fruition. Government warranties, when you have an ever-rotating leadership environment. And then in healthcare, especially PPPs in healthcare include negotiations with all stakeholders. It's not PP, I would say stakeholder engagement. It's not only private and public sector. You have to include academic institutions, patient groups, NGOs, international organizations like WHO and whatnot, or whatever, sometimes UNICEF, these international organizations, scientific societies also, you need a seal of approval from the scientific world, etc. There's many, but these are the major ones, and they all have to be on board for a successful project to come to fruition. It's a 360 approach, I would say. We call it PPPs, but it's more than private public. Unintended consequences analysis also. Many unintended consequences can lead to unwanted outcomes, including the loss of life. So that is another variable that should be included on every project, PPP project. And periodic policy reviews, I would say. All of the frameworks have to be updated on a regular basis. Yeah. So my big takeaway is good intentions are not enough for successful PPPs in healthcare. You need robust policy and regulatory ecosystems. Yeah, especially for healthcare, where you have patients that time is health. Time is health. Sometimes in policy, you miss a doses of a medication, and many things can
make for
happen.
good neighbors. I think you've really crystallized it there. Thank you so much.
Thank you.
How are we
both.
doing
Thank
for
you,
time,
everybody.
Gazi?
Yes, we are okay. I mean, we can have questions, but we are okay with time. I mean,
I think there was just one question that came up in the chat to Felicitas. It's not a question as such. If you can add the publications that you mentioned, maybe if you have URLs or something, just put them in the chat. So
yeah, I can put on the chat the link.
Yeah, please.
Yeah. Okay.
Yeah. Thank you. Okay.
Thank you.
Thank you, Felicitas, for your valuable recommendations and findings. Now I'm going to jump to the other panelists if there is no questions, but okay, we can have a session at the end for question and answer, so we will be here again. So I'm going to jump to Mario. Mario, please first make your introduction yourself, and then we will start discussing a little bit on the PPP policies and PPP programs and the other things later.
Thank you, Gazi. Thank you, Nasser, also for the invitation. It was my pleasure. It will be my pleasure today to share some of the experience that I have in the field of the PPPs. Well, I have let's say 18 years of the experience. I started in the PPP agency of Croatia, so I was responsible for setting up the legal framework there, and I was also leading sector for the assessment and approval of PPP projects. And from, let's say, 2015-16, I've been working as the expert consultant, mostly on policy, PPP policy issues, legislation, institutional setups, the issue of the alignments with the EU regulations, because most of my work is connected to the Southeast European countries, which are the EU accession countries as well. So there are certain requirements in regard to EU, what you have to do when you are setting up the framework for PPPs. My experience is mostly connected to small countries, to small markets. So maybe that also could be, I don't know, interesting to share some kind of experience or lessons learned that I got. Many of these are basically common or very similar as what Felicitas shared with us. So I was just nodding my head while she was speaking, because I agree with many of these issues and many of these takeaways that she offered. And as I said, this is mostly based on the experience that I got in these countries of the Western Balkans, let's say, and Southeast Europe. So this is for some kind of introduction, and I don't know, maybe we can start with some kind of discussion, or if you have some specific questions, maybe then I can offer some of my some of my lessons learned, let's say.
Yeah, okay. Mario, please, can you, start sharing something about the programs, PPP programs that the countries have. Do you think that they are important to have it?
Yeah.
Or do they bring some difficulties to implement, or it's better to have a program and to follow it? So what's your experience, what's your advice? What can you say?
Yeah, so basically I would say that some kind of common understanding, if I may say so like that, of having the, let's say, efficient PPP system is to have certain ingredients. So I would say the first ingredient is to have some kind of strategic approach, to have this kind of political commitment, so that the government wants to do certain projects via use of the PPPs, including concessions. And this is often demonstrated by some kind of policy paper and PPP strategy and things like that. Sometimes these kind of, political commitments are more declaratory and not so, in some specific situations, not to be substantial, I would say, in a way. Second element is basically that this political commitment is transferred into a certain framework. So we are talking about legal institutional framework, and Felicitas already mentioned what is basically asked of the legal framework. I also have my specific experience regarding different institutional setups, which can I also share a little bit later on. And the third element basically is then to transform, this kind of commitment to certain projects. So the best would be to make, the project pipeline, to make some kind of PPP program, because then this PPP program offers some kind of, the sense of the continuity of the projects which are, initiated from the public side. And this is also a good sign to the private sector to be ready to mobilize certain resources that they have to mobilize in order to participate in those tenders. But from my experience, and I'm just now again repeating, these are, small countries, small markets. It seems in general that it's not so easy to make a PPP program. It is not so easy, to define certain projects which would be viable as PPPs. So it's always some kind of issue how to do it, how to start it, how to analyze certain strategic strategies, how to prioritize between different, projects, whether to go first with some kind of end users type of the projects, which we call concessions, or with this social type like PFIs, or government-based projects, how to make bankable projects. So there are lots of, these kind of issues and challenges. And I think that these PPP units in these countries, should take some responsibilities in order to address some of these issues. Because as I mentioned, small countries, basically, they do not attract a lot of, big advisors or big companies, who are gonna be ready to assist them in assessing those projects. So mostly, with some exceptions, there are certain exceptions. I don't know, in Croatia, we have in the county, one region, a big PPP program of doing, in social infrastructure, so the school PPP program. So the guy who was running this region decided to do all the schools. So there is construction and the construction of the new schools through the PPP model, so through the PFI model, so the public site-based type of the model, and basically that proved to be very big success because they have a strategy. They wanted to they knew what they want to achieve with this program. They wanted that all kids going just in the school to the school in the morning, so that they have free time in the afternoon for different type of the activities. And basically many of these kind of impacts what they expected to achieve happened. So they had like an increase of the kids or the pupils who are enrolling the faculty. They had an increase in results on sports competitions and things like that. So when we are talking about this value for money, this is also something to take into account, not just the financial or the fiscal aspect. In some other countries, there are not many, I would say, dedicated structural programs. Mostly we talk about some individual projects, some pilot projects, mostly first in some kind of transportation infrastructure, done as a concessions, because there is this kind of, already experience from the past with some sort of concessions. While the use of this availability payment mechanism, it is something which comes mostly secondary, some kind of the second wave, although this experience from this Županija region in Croatia proves the difference. So I would say it is very important. The foundation of having the good system is to have, this strategic approach, to have this political will, and that this political will is real, not just some paper demonstrative, some kind of declaration. So it is very important to have this kind of focus, and then of course with some other aspects of having the efficient system, the legislation, institutions, and so on. But without any this strategic approach and this strong political will, I don't think it is possible to have good pipeline, or to have good projects, or to have the efficiency achieved at the end, the value for money, what we all want from each of these projects.
Yeah, very clear, Mario. Yeah, thank you about that. So as you were speaking, and also Felicitas mentioned a little bit, I remember that we have both coming from the PPP units, and so I would like to share. I mean, what do you think about the institutional framework? I mean, what's your experience? What's your advice for the solution?
Yeah.
It's important, I think, in this process. It's same important as the program itself and the legislation itself.
Yeah, I agree with you. So there are different approaches in different countries, not just in Western Balkans, but I would say over the world. And mostly, these PPP units, they have kind of three type of tasks. So let's say, or three type of different possible tasks that they can implement in practice. So there are these policy type of the PPP units, which deals with legislation, guidelines, some kind of communication, international cooperation, and things like that. Then there are these project kind of delivery institutions, so which are mostly helping and assisting contracting authorities in the preparation of some feasibility studies, assisting them through the procurement, even through the management phase of the project implementation. And there are these gateway type of the PPP units, so that they have this kind of approval and quality control. And usually these PPP units, from my experience, they have something of the policy, type of the task, and then either the project delivery or approval and quality control. When we're talking about the region where I'm coming from, with the exception of Albania, I have to say that mostly these PPP units, have this kind of approval and quality control. And this is how basically, and there are different, reasons for that, because when you start with some kind of, and again, saying that we are talking about, small markets, small countries without any previous experience. So basically you want to, and I know from my experience from the PPP unit in Croatia. So basically you start like with those more reserved, kind of position that you want, participate in that regard. So to assess, to approve some projects, to learn from those projects, to learn from, all the stakeholders which are involved, advisors and everyone else. And basically then the idea was to transfer the type of the agency to the project delivery type of the agency, but then there was some change of the policy in Croatia. Some other institution was set up which was not very good, in project delivery, and the existing institution kind of, we start to leave that institution. So that there was kind of the mess in Croatia in that regard. So this is also one of the lessons how this policy issues, policy approach, strategic approach is very important, and it's not advisable, to change things harshly without thinking what is going on, how that would affect to the future project delivery. But since these small markets, since these small countries, there is a very lack of an experience in PPPs, and contracting authorities have big issues how to identify PPP projects. They have big issues how to start with something, how to do feasibility study, how to do feasibility study. This makes me to think that I would say that let's say some kind of recommendable approach would be to have this type of the PPP units that can, assist the contracting authorities in doing this type of the stuff. So, to overcome these kind of gaps that are existing before, some, big projects or some pipeline, or I don't know, attract some, big players like, I don't know, international organizations or some big, advisor companies or so on. So this is something that I see in many of the countries where I work in. So it is very difficult, to start to do something with the project. It is very difficult to, transfer certain project idea to the project proposal, to certain documentation, to frame it in a way. And I think that PPP units should have that role. The other question is also the capacity building of these PPP units, because it's, I know from my experience when I start working in it, I didn't have any experience, so I have to learn a lot, to go to the conferences, to receive different kind of the assistance. So it's always an issue how also to build up the, administrative capacities of those institutions and those PPP units in order to get them to help the others, prepare projects. So I would say, so at least in countries where I work in, I would say this kind of, more proactive type of the PPP units would be recommendable.
Yeah, thank you about that, Mario. So I want to jump because the time is going very fast, and I want to go a little bit faster. But this is an important issue I want to share now with the audience. Mario has has a lot of experience with EU regulation. I mean, for the accession of the EU regulations. Mario has the huge experience on that, and of course, Croatia, that has entered the European Union recently, so it is almost fresh on them. So please, Mario, can you share some elements of this process? It's not interested for all the audience, because we have a wide audience from every continent here. But please share your experiences, because it might be useful for the others.
I will be very short, and this is what I doing right now in your country, in Albania. We are doing the new PPP law. Yeah, so when we are talking about the legal frameworks for the PPPs, there are certain, requirements by the EU legislation that has to be, taken into account. It always depends on how you define PPPs, whether the PPP is some kind of general term that then can relate to this government paid type of the PPPs, like PFIs, and concessions, or PPPs are basically these, let's say, PFI types of the PPPs. But in any case, when you are regulating concessions, then you have to align with the concession directive, and concession directive in terms of the selection procedure, the procurement, allows certain flexibility. So you can make some kind of more flexible procedure, but okay, you have to obey certain, the principles which are defined by the concession directive. But when we are talking about the PPP, or let's say this government paid type of projects, basically these are seen as a public contracts in the terms of the public procurement directive. So in terms of the selection procedure, basically you have to align it with the public procurement procedure from the public procurement law. So it is not something that you can, create outside of the scope of the public procurement directive. And I know that this is sometimes very difficult to explain, when I was working in different countries, because when they think about PPP and they think about something which is out of the public procurement system, and they are thinking about it in a way that they can, make certain procedures which would be the most suitable ones for the, let's say, selection of the private partners, ignoring the public procurement directive, which is not possible. That, I don't know, in a way could be seen as something restrictive, but I don't think so, because I think the public procurement directive, with all these kind of public procurement procedures, often I think enough space or enough tools to get the proper or the best bidders for certain projects, especially one which are tendered in this social type of the infrastructure.
Yes, thank you, Mario, about that. So I would like from you now, because the time is running,
Yeah, sorry.
So the final conclusion from your side. I mean, if you have any remarks to share in short.
Maybe, yeah, and I like very much the stuff Felicitas told about, the transparency, about the people participation. And I saw it, okay, we don't have much time to share some, experience on some specific projects, but many, situations when, this lack of the strategical approach, when something started with one mayor, stopped with the another one. Also, when on some projects, some information about projects haven't been shared with the people or with the different, stakeholders and organizations that should be, let's say, consulted or informed. And then it makes some kind of opposition, to the project. Sometimes it kills the project. So I think it is very important to think also about that element. So, to have the proper communication strategy to include everyone who has to be included, and to, get everyone on board. I think it is very important to get everyone on board, especially saying again, working in small countries, no big project, not having lots of projects. So, every project is important. So if you do something wrong with the one project, that it, makes some kind of bad example for some other future possible projects, which you want to avoid in any case. So this is, let's say, something of the last message that I would to share with you.
Thank you, Mario. Thank you very much for your valuable experience and you shared with us. So if anyone has questions for Mario especially, but at the end I will give some minutes for the question and answer. So without losing any more time, I'm going to go to the last guest, which is Priscilla. As I mentioned, is the special one because there is the morning now. So good morning, Priscilla. She is from Brazil. So you can introduce yourself. Priscilla is gonna share a presentation with us. Please, Priscilla, because of the technical issues, we just couldn't enter in her name in this webinar, but she has a name of Mario, so sorry about that.
No problem. Thank you. In the first place, thank you so much for
invitation. It's an honor for me to stay here in the morning, but it's a very special panel and is important working about this infrastructure for the people in first place, because the social infrastructure is a people first place in these projects. So thank you again, Mario, for sharing with me your link. Sorry about that, but thank you so much. And my name is Priscila Romano. I live in Brazil and I work here. This presentation in English is great for change for me because my English is not so good. So I'm sorry, but I can. I try and
Yeah, no problem, no problem.
share with us for my experience here. I have 3 projects in social infrastructure. The first PPP hospital in Brazil, the Suburbio Hospital in Salvador, Bahia, the first experience here. And for me, the social cost of the government is benefit the available service of society. So you can working about the projects and first time for the available the service for society in this case. So I prepare 3 points about the questions. The value creation is a mobilized private investment, improved service quality in these areas, and include best practices for the work. So a technical and a financial and legal studies is very important, but the risks allocations and payment models is a very important point for this, and engagement the stakeholders in this process. But the governance and sustainability, it's need clear frameworks and accountability and monitoring and machines, and the climate resilience and long-time trust for the green schools, energy efficient and hospitals. So this point is the start for change the reality here for projects in health, education, mobile, and the key performance indications is a very important international experience for share with us, and the transparent reporting and the independent audits for reinforcing credibility. Okay, and this is a principal point, and inclusive and social impact on target understand and the servicing communities and accessibility, affordability, and community engagement. So these projects here. So the public goals with private innovation and governance and sustainability in our credibility. The social includes multiple priorities here. So it's the keys, takeaways, and change the service from most high innovation and results and performance. I think the building lasting social PPP is delivery value for to society and the people and for place for many sectors in Brazil. The Bahia State is a case for the another stakeholders and another governments, the subnationals, for these legal contracts and I'm sorry, I'm very nervous.
No,
I
no problem.
forgot the name. I'm sorry. And another's KPIs. I'm sorry.
KPIs, yeah.
KPIs, yes.
KPIs,
Thank you,
yes.
Jasmine,
No problem.
for this point. So I think the transparency, trust, and inclusive the community for these discussions and the academy felicitas talk about this, and
Yeah.
I think it is a very important point because have a very demands about new process and humanity and I'm and the people need this understand more this political social sector.
Yes.
And
So
Gasmin, you
we'd like
need
to thank you. Yeah, we'd like to thank you, Priscilla, for bringing your
I'm
opinions.
yeah.
Yeah, thank you very much. I told you, but because sometimes when you are the last, you have to talk shortly because the other people don't give you space, So I'm
No,
sorry for
no
that.
problem.
I'm sorry for that, but we have only 5 minutes. So if you want to conclude, and then we jump to some question and answers because it is limited time, and it finishes now. So please make your conclusion, and we are going to jump to the section of question and answers.
No. I would like to thank you again, and I would like to talk about these important public goals, and I stay here for any questions and share with
Okay.
us a little presentation in English
Okay.
about the cases models in Brazil, the social impacts, and I believe they the working is the PPP centers and share these 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 experiences is very important for the Americans and another projects and change the reality for the social because in Brazil and the other places is very high high numbers and deficit of infrastructure. So thank you again.
Thank you.
And
Thank you
a
very much,
pleasure
Priscilla.
for me. Thank you so much,
Thank you very much.
colleagues.
So we will
And
share to everyone
nice to meet
everything
you.
that we have. Thank you. Thank you, Priscilla.
Thank you. Thank you.
So now is the section, I mean, very short because we have only 5 minutes, let's say, but please, if you have any questions, please write in the chat, and then we have our panelists here to answer. And thank you everyone that was
We don't have,
participating in this.
Yes, there are no questions in the Q&A. There was one from Arun to Luigi earlier on, which Luigi has answered by chat, and I'll just read out if people haven't noticed that. So, what is the rationale for a government initiating a public-private partnership without first conducting a feasibility study or VFM? And Luigi answered saying that PPPs should not be started in the absence of a solid feasibility study. Nor should any public investment actually be started without a feasibility study. And then he went on about value for money, which kind of resembles the point we were talking about earlier, that value for money is an elusive concept that contains elements of subjectivity. If you want to kind of elaborate on that some more. I mean, should investment projects, direct or PPPs be done without a feasibility study?
But I don't think that we have always, I mean, all the legislation that we have seen, they definitely do not bypass this section. So it is the most important section in every legislation. And even Mario touched it, that he said that during the preparation, I mean, the PPP units should stay close to the government and to the contracting authorities to help them, and the help is exactly in this part, because this is the most important part of the project. So I think we covered it and we explained it during this webinar.
I don't see any other questions.
Yes.
Like embedded in the
So
chat.
we brought some experiences, as somebody was asking about some real experiences from examples. As I see, but during our talk, every panelist brought his own experience. So I think we covered everything.
Great. So I think we can bring this to a close. I'd like to thank the panelists, Luigi and Absentia. I think we heard some really outstanding points and insights from you. Clearly, there's a lot of experience around the table here. So thank you very much for this really insightful panel. There's a question that seems to come up. There is one. Tariq Saloom, we have conversed a lot about policy and regulations, hence the subject to a purpose of the webinar. However, we didn't hear if there is any push on enhancing the procurement process of PPP with the use of artificial intelligence and LLMs. Not sure what LLMs stand for. I seem to remember that was some postgraduate degree in law. Okay, LLMs, that to do with machine learning. I don't know what the acronym stands for.
Language learning machines, maybe.
Yeah, live learning machines, maybe. Anyone would like to offer an answer to that one? Enhancing the procurement process of PPP using AI. I have a feeling, Tariq, this is not really the right audience for this.
The right panelist. No, I'm not an expert on artificial intelligence, but in healthcare, at least, it has been helping, enhancing all the processes.
Sure, but the question was,
but not on procurement.
On the procurement process,
yeah.
I mean, I know from my colleagues who are dealing with the classical procurement that there are, lots of discussions about it, how to use artificial intelligence in let's say, classic procurement of classic contracts. I have colleagues and friends who already invented some, types of the artificial intelligence, helping contracting authorities in doing the procurement. anything what can be, applied for the procurement of classic contracts, I believe also can be applied to the procurement of the PPPs, with certain modifications and adjustments. I personally don't have any, practical experience in that matter, but I assume this is something that's gonna, happen soon in one way or another.
There is an example in Albania recently introduced, but it is quite new, It's
Yeah, I saw it.
it is kind of procurement process, but not for PPPs. I mean, because PPPs are complex, and it's no way doing at the first.
What's her name? I forgot it.
There's some Dila is called,
Dila,
but it is some kind of, it's some kind of more political show than the exact thing, but it is somehow the procurement are going to be evaluated by an artificial intelligence, but this is not quite implemented yet. It's just a project. Maybe it will come to life, I mean, soon, but it is some kind of automatic evaluation of these things that can be automated. So I don't think that it will be going to work standalone, but the most important thing is that it is coming to life somewhere in the world,
Yes,
So
yes.
this is the good news.
Okay, I think we're done with time. So
Yeah.
again, thank you very much to the panelists. Thank you, Ghazi, and thank you to the audience for being with us. And see you at the next WAP webinar.
Thank you
Bye-bye.
very much.
Thank you very much.
Thank you very much all.
Thank you.
Thank you.
Thank you.
Thank you so much.
Bye.
See you. Bye-bye.
Bye.
Bye.
Thank you.
Thank you. Thank you.